So we're going to start first with the cervical spine. So the cervical spine is the neck. For those of you that don't know that term, it is 7 movable vertebrae in the right underneath the skull, obviously. And one of the things that happens over time is that the neck straightens out. There's actually in the diagnostic literature now something called text neck or technology neck, which is basically a straightening of the cervical spine. It really from the side should look like this for many reasons, especially with young children and teenagers getting cell phones so early. We have that going on, but also people that sit at desk long hours and commute to work and through using our own technology, this gets straight and that creates a lot of muscle tension in the neck. So I want to give you 2 really simple things to help with re-engaging the curve here so that we start to relieve some of the muscle strain there, which relieves upper back tension, neck pain, and headaches. It's not a cure for that, but it is something to help along with your adjustments. So the very first thing is that people think to stretch the neck, we need to go side to side and forward and back. That's actually not how the vertebra and the joints work. The joints move in a rainbow direction. So they move in this kind of a plane where it's literally like a rainbow. So if you're sitting in your desk right now, or you sit on a regular basis on the hour, every hour, I want you to look up to the back of the room, back down, up to the other side of the room, and back down. So this is your motion. You don't have to hold it. The neck doesn't necessarily like static holding stretches. It likes mobility. And the more mobility we get into the joints, the more they're lubricated, the more they're nourished, and then the cervical spine will be much, much happier. The second thing, this goes along with brushing your teeth every morning. You grab that hand towel, brushing your teeth in the morning at night. You grab the hand towel that sits right by your toothbrush. We want to roll it up long ways, and then you just put it right behind the lower cervical spine. It sits right on the base of the shoulders, basically, right where your neck starts. You don't have to pull here. That's not the intention to pull. But all we want to do is use the weight of our arms and just let the head just gently relax. Now, if you get dizzy or something like that, back off, do less. But to have this going on in a regular part of your life, along with brushing your teeth, washing your face, do your cervical stretches. So even though this is just a cervical video, and maybe you came for this, be sure to check all the rest of the videos out because this is all about spinal health and we all could use some more of that. So